If you thought you had a high-pressure job, spare a thought for those running the World Health Organization. The World Health Organization, or the WHO, certainly has some impressive achievements on its resume. It helped to eradicate smallpox, which was easily the world's most deadly disease. The spread of malaria, yellow fever, and HIV has also been greatly reduced thanks to the WHO, not to mention widespread educational programs aimed at improving world health in general. But the WHO has also been accused of dropping the ball on occasion. This was most notably during the COVID-19 outbreak when the organization was criticized for reacting too slowly before sounding the alarm to the global community. While the WHO should take some responsibility for the crisis, it's important to remember what its actual roles are. So, what is the WHO and how effective is it? The World Health Organization was established in 1948 as an agency of the United Nations. It originally had 53 of the 55 UN countries and was based in Geneva, Switzerland, where it remains today. There are 194 member countries with over 150 offices and branches around the world. There are currently over 8,000 WHO staff working in a variety of roles ranging from scientists to doctors and consultants. The Director General oversees all operations of the WHO and is elected to a 5-year term. Member states propose suitable candidates who are then selected by the WHO's assembly. The initial goals of the WHO were to control the spread of diseases such as malaria and tuberculosis, as well as improve the quality of children and maternal health around the world. In essence, this is still very much the focus. Obviously, some diseases such as smallpox have been eradicated, while new diseases have since come to the fore, but the overall goals of the World Health Organization have remained consistent since its inception. The organization officially proclaims that it wants to ensure that everyone everywhere can attain the highest level of health. This includes pushing for more widespread universal healthcare, protecting poor populations from health emergencies, and improving the overall quality of life that is still lacking in over 1 billion people. The regions around the world of most concern are situated largely in Africa, with some Central American and South Asian countries also requiring more ongoing support and funding. Which brings us to a key point. How exactly is the WHO funded, and how much money does it get each year? All member countries are obligated to contribute something every year, based on their GDP. So, not surprisingly, the US, China, Germany, and Japan are among the biggest sources of funding. For example, in 2022, America provided at least $800 million, the UK $500 million, and Japan $200 million. This is what's known as fixed funding, which accounts for roughly 20% of the annual WHO budget. The remaining 80% comes from voluntary funding. Again, the US is a major contributor, averaging around $400 million per year. The EU, Great Britain, and France are other notable sources of funding. The Bill Gates Foundation is another regular generous giver to the World Health Organization. In fact, the Gates Foundation is usually second only to the US in terms of dollars provided. In 2019, the US made a voluntary contribution of $890 million, while the Gates Foundation forked out a whopping $530 million on its own. As impressive as this may sound, it's still woefully inadequate. The total estimated WHO budget for 2024 is about $6 billion. By comparison, the healthcare expenditure for Belgium is $55 billion. The relatively paltry spending power of the WHO raises questions about the body's effectiveness and ability to meet its objectives. This was a particular case in point during the COVID-19 crisis. The WHO was lambasted by an independent panel that investigated the management of the pandemic. The panel called the handling of COVID-19 the 21st century's Chernobyl moment and singled out the WHO for its ineffectiveness. Helen Clark, the former New Zealand Prime Minister, was on the panel, and she did not mince her words. Clark said the WHO's alert and response system, quote-unquote, seems to come from an earlier analog era and needs to be brought into the digital age. She went on to argue that modern information systems are far more adept at picking up potential diseases through data sifting. While the WHO would no doubt love to get its hands on such cutting-edge technology, it simply doesn't have the funds to set up such a program. However, the criticism of the WHO during the pandemic was not restricted to archaic software systems. Several experts claimed that the WHO should have warned more people more quickly during the early stages of the outbreak. Imposing faster travel restrictions and curfews would have slowed down the spread and given countries a fighting chance to combat it, according to the critics. But to be fair, the lack of transparency from China meant the WHO had limited access to data and subsequent decision-making. A similar criticism was made of the WHO after the 2014 Ebola outbreak in Western Africa. Again, many claimed the WHO was too slow to step in and make sure the correct procedures were being used to limit the spread of disease. However, this is a common misunderstanding of the WHO. Rather than acting as some kind of global health police, the WHO's main role is to instruct, guide, and advise on health policies and emergencies. It's up to individual countries to take the advice on board and implement the recommended strategies. Besides, the WHO isn't legally permitted to simply waltz into a country and dictate terms as it sees fit. This isn't just a burden the WHO has to bear. Other international agencies such as the World Bank and NATO are sometimes incorrectly assumed to have the power to step in immediately and resolve situations. What then are the WHO victories and successes? Once again, the most obvious one has been helping to rid the world of smallpox, a disease that killed hundreds of millions of people around the world. In the 1950s, the WHO formulated the Global Smallpox Eradication Program, which brought all member countries together in a bid to properly vaccinate and monitor the world's population. Cold War enemies, America and the Soviet Union, worked side by side with WHO scientists, and by the late 1970s, every continent on Earth had been safely vaccinated. The WHO's largely advisory role cannot be underestimated. Huge inroads have been made throughout the developing world in lowering the risk of disease via customized educational programs. For example, the WHO staff have been able to reduce the spread of malaria and yellow fever by visiting susceptible regions in Africa and South Asia. They've advised medical authorities on vaccines and procedures and instructed local governments on the importance of insecticide spraying and environmental engineering to combat mosquitoes, the major cause of such diseases. In 2014, the WHO again demonstrated its effectiveness in negotiating with governments and health bodies about medicine. Drugs to treat hepatitis C had become available, but they were at exorbitant prices. The WHO worked with governments around the world, convincing them to increase funding and to make such drugs cheaper to the masses. And the benefits were huge, particularly in countries with large populations like India and Pakistan, where hepatitis C drugs became much more affordable. Going forward then, what are the main challenges for the WHO besides funding? A constant issue has been getting vaccines and medicine to the people who need it the most. However, many major pharmaceutical companies haven't always been compliant, and they've had their own agendas. Some governments have made the WHO's job harder by failing to supply requisite data or grant access to facilities and laboratories. If a government doesn't assist the WHO with requests to medicine manufacturers, there's only so much the WHO can do. Ultimately, though, it does come down to funding, or rather, lack thereof. The Gates Foundation should hardly be expected to continue outspending the majority of member countries in funding. Rather, countries should be forced to contribute more, or the WHO is at risk of becoming redundant. The immediate goal is to improve the health standards of third world citizens, the majority of whom live in Africa. If the WHO can garner enough funding to be able to send in staff to fully implement effective health programs, the wheels will be in motion. Ideally, the World Health Organization is looking to first eradicate major diseases, and then work with governments to improve the life expectancies and quality of health around the world. That would mean starting to seriously address some of the major health issues in the developed world, which are generally related to heart conditions and disease. The WHO has a largely thankless job in an increasingly multipolar world. This means that it has to tackle sensitive geopolitics and persuade even the most suspicious countries to come together and meet halfway, and then to convince world governments that only by sharing innovations, ideas, and technologies can quality of life objectives be achieved. Once again, we should look at the critical role the WHO played in eradicating smallpox. We got to. This was a perfect example of what the WHO was set up to do, to be nonpartisan and to work cohesively with international governments for the betterment of global health.